Good morning, everyone. Sorry, I was running a little bit behind schedule. Just had a few room changes and then the internet stopped working, so I couldn't connect. Good to see everyone's here.
Yes.
Yes.
Happy Easter. Hi, Beatrice.
Hi.
Did everyone have a good holidays?
Yes.
Yes, thank you.
Yes.
Yes.
All chocolate consumed.
No.
Maybe a bit left over. Yes. All right. Well, we will get started with the EVO education component, and then we'll go straight into the exercise and not waste any more time. Today's session focus will be on cardiovascular health or heart health. So as I said, we'll do a bit of education and then we'll get going on the exercise component. All right, let me just get set up here. All right, so the role of cardiorespiratory exercise in preventing and managing cardiovascular disease. So there's a lot of studies out there that show if we exercise our heart and our lungs, we have a better chance at preventing any comorbidities occurring of the heart. So exercising the heart and lungs, that's any of those high intensity exercises like running, where you start feeling that you're getting a bit puffed or you're moving quite quickly. So for prevention, studies show an association between sedentary behaviors and or low cardiovascular fitness and health outcomes like type 2 diabetes, cardiovascular mortality, and all-cause mortality. So there is an association between people who don't move quite often and then those big diseases or big conditions like diabetes or heart disease. So reducing excessive sitting to less than 3 hours per day and excessive TV watching to less than 2 hours per day can result in gains in life expectancy of up to 2 and 1.5 years respectively. So you can add on a few years just by reducing the amount of time that you're sitting, amount of time that you're watching TV. Physical activity is associated with a 35% risk reduction of death from cardiovascular disease and a 33% risk deduction of death from all-cause mortality. So there's a strong dose-response relationship, i.e. the greater the volume of exercise, the less the risk of mortality. So that's why we do these exercises like EVO. We do them twice a week because we're hitting those sort of exercise targets. Even 15 minutes of daily exercise is associated with a significant reduction in risk of developing cardiovascular disease. Therefore, some exercise is always better than none. The best way to reduce your risk is a combination of regular exercise and dietary or pharmaceutical interventions. So taking the medications that your doctor prescribes you because he's given it to you for a reason. All right, so preventing or the reoccurrence of a cardiovascular event. So if you've been hospitalized because of a cardiovascular event, then these are some of the ways that you can reduce a reoccurrence. So participation in cardiorespiratory exercise is independently associated with decreased mortality and recurrent heart attack. So basically what that means is participating in these sort of activities like we run with EVO, where we get your heart rate up, that is independently associated with a decreased risk in a heart attack or seeing that event come again. There's a 5-year mortality rate. 5-year mortality rates are 21 to 34% lower in cardiovascular disease patients who perform aerobic exercise compared to cardiovascular disease patients who do not perform exercise. So you're seeing that 5-year difference in people who perform and people who don't. So exercise, there's another little fun fact, is exercise may reduce atherosclerosis, which is where in your blood vessels like your veins or your arteries, they normally start about this wide, and then due to the fatty foods that you eat or sort of your lifestyle factors, this sort of hole where the blood flows can decrease inside due to plaque build up on the inside and make it harder for that blood to flow through. So exercise can reverse that and open up that passage again. All right, so moderate continuous exercise versus high intensity exercise. So there's current guidelines for those with cardiovascular disease and heart failure patients. Just have a look. So HIIT has become a growing trend in the fitness industry due to many factors. For example, it's very convenient for time poor individuals because you're just going straight onto that high intensity and you're doing it in a very short amount of time. And it's often less boring than moderate continuous intensity due to the changes in intensities, the faster fitness improvements, etc. In cardiovascular disease patients, the main protocol used is a 4 by 4 minute increment, which is every 4 minutes. After 3 months of intervention, peak VO2 or increased more in HIIT groups versus moderate intensity. So basically what that's saying is they did a little study, and after 3 months of intervention, they compared the people who were doing high intensity compared to the people who were doing moderate intensity. They found the high intensity had a greater increased, I guess, response. So we might get into a bit of exercise, but firstly, have any of you guys been diagnosed with a heart condition or anything, maybe like high blood pressure or high cholesterol?
Yes.
Colin, what have you had?
I have, I'm a HOCM patient, which is hypertrophic obstructive cardiomyopathy.
Yes, yes, I know that one. Oh my God, a HOCM.
Right. I also have a pacemaker.
Yes.
And I have 2 stents in the right coronary artery.
So you've had a bit done, haven't you?
Just a little.
Was this making sense? I guess this is to everyone now, what I was saying. I know I was reading off a piece of paper and there were some words that were quite, I guess you wouldn't have heard them, such as like, you know, the moderate intensity or the HIIT intervals, some of those bigger words that I was using, but I guess did my explanations make sense? Basically, if you're doing some exercise, you're better off than doing none. And there's a few studies out there that have shown us those improvements. But yeah, did we have any questions about any of that?
No.
Pretty good. All right, so I'll just finish off with this last little bit of education, and it's just about how much aerobic exercise is enough. So it's just around the guidelines. The current guidelines show that in regards to frequency, they recommend most days of the week that you're, I guess, moving. So they say at least 5 days a week, but if you're doing it anywhere between 3 to 5, that's great. In regards to intensity, how hard you should be working, minimum of moderate intensity. So on a scale of 0 to 10, 0 being nothing at all, and 10 being, oh my God, you're about to pass out from working so hard, they want you at a minimum working at a 4 or 5 out of 10, so that halfway. And then i.e. like you're huffing and puffing, but you're still able to hold a conversation. So from there up. In regards to time or how long you should be exercising, anywhere between 30 and 60 minutes. And this can be accumulated in small sections or small little bouts, such as 10 minutes at a time. So you could break up that 30 minutes or that 60 minutes and do them throughout the day, or you could just do it like we are, a 30-minute exercise session. In regards to vigorous intensity exercise, so when you're working in that quite high intensity, 9 out of 10, 8 out of 10, that counts for double the duration. So if you were working at a really high intensity for 15 minutes, then that's equated to the same as 30 minutes of moderate intensity, going at that 4 or 5 out of 10. So it makes sense that the harder you work, I guess you're a bit more rewarded. Some of the types of exercise or aerobic activity that you could be doing. Current guidelines suggest anything along walking or cycling or running or swimming, any sort of sports or gardening or housework, any rhythmic movement that sort of makes you huff and puff. So there are just a few examples that we just went through. All right, guys, so we're going to go on with the exercise component. So if you want to stand up, we'll go through our warm up. And then, Colin, are you still seated or are you able to do any leg work?
I'm going to try and do most things except the lunges.
Okay, so we'll just take it as it comes, and I'll give you a bit of an alternative if you want it. All right, let me just get my space set up.
Right there.
All right, so we're going to do our warm up and start off with. So can we do our breathing? So big breath in, arms reach up to the sky, and breathing out, arms come back down. Big breath in, back down. Big breath in, last one. All right, just while we're here, can we cross our arms over our chest? And we're just going to twist over our left side, breathe out, twist over our right side and breathe back in. And you're just going to do that a few times. All right, from there, we're just going to do some walking on the spot. So just while we're here, just trying to get our arms by our side. Good, and we're just trying to get that heart rate up a little bit, start moving our muscles. As we're walking, can you tap in front with your heel? Tap, keep walking, tap with your heel in front, and we're going to do left side, right side. So you just keep alternating as we're walking. Few more. All right, we're going to do 2 steps forward, 1, 2, do a squat, 2 steps back, 1, 2, and squat. So just doing a little light air squat. 2 steps forward, squat, 2 steps back. Good, a few more of these. All right, from there back to your walking on the spot, moving our body. All right, we're going to go into our arm circles. So spin your arms, and you can do a big step to the side, big step left, big step right as you do your arm circles. Great. All right, going backwards with your arm circles. Going the other way now. Keep it going. All right, standing still. You're going to see how wide you can do those arm circles. So you're just trying to stretch your arms up, back down. You can go as high as you want. All right, can we go the other way now? So changing directions with the arm circles. Again, going as high or as wide as you want. All right, standing there, shaking your body out. Can we go into our shoulder roll? So just rolling your shoulders backwards. Now that we've done a bit of those arm circles, rolling your shoulders backwards. Holding that good posture, good. All right, then we're going to do some marching on the spot, so lifting our knees up as high as we can. So if I did this on the side, you can see how high my knees are going. Good. All right, can we do our butt flips? So going backwards this time. Just a light little stretch here. You're just trying to flick your leg up, side to side. All right, standing still, give your body a bit of a shake. You can grab a drink of water if you want. We're going to go straight into our first round of exercises. If you need a drink throughout, make sure you're grabbing your drink, but we're going to just go through these exercises. So the first one will be a squat, so a little air squat that we were doing, and then you can hold onto a wall or a chair, and we're going to go one leg goes out. And we're going to do both legs. And we'll see how we go with that one. So what you can do is put a chair in front of you. So holding onto the chair, you can do a squat and you can kick left and then kick right, if that's comfortable. All right, and a regression for this one is to just do the squat. So you can add in leg kicks or you can take them out. So just see how you guys go. All right, we're going to go in 3, 2, 1. Off we go, squat. And then if you're doing the kicks, making sure you're kicking out left and right. Otherwise, just keep squatting. Good, guys. A few more. When you kick out, just make sure that your body is straight and you're not sort of twisting or bending at the front. You're just kicking those legs out, right? Few more. 3, 2, 1. Alrighty. From there, guys, we're going to go straight into walking on the spot. So we're going to try and keep our body moving this whole time. And we're going to see if we can just keep moving through the exercises while the time is going. All right, so you're going to need to grab your dumbbells for the next one, but I'll tell you when, so we'll get a bit of a rest. So we're going to be walking for 30 seconds, have a 30-second rest, and then we'll go into our next exercise. All right, 3, 2, 1. Getting rid of your chairs. Our next exercise, grabbing your dumbbells. We're going to go 1 dumbbell in front, 1 dumbbell to the side. So you're making an L shape raise. Good. And you're switching sides. So I'll just get the timer going. All right, in 3, 2, 1, off we go. Going up just to your shoulders and back down. So remember, you can do this one with or without dumbbells. So we're going to do this exercise for 30 seconds. Then we're going to have a 30-second rest. And we're going to go straight into the next exercise, which will be our walking on the spot. So we'll always do 1 exercise and then walking. 2 more, 2, last 1. 1. All right, we have 30 seconds, so have a bit of a break. Put the dumbbells down. As I said, our next exercise is just walking on the spot. So if you're standing there, walking on the spot. And we're going to be walking for 30 seconds. While we're walking, I will explain the next exercise. So the next one will be lunges, or you can do it squats if you want, Colin.
Right.
So we'll just keep going for the last little bit. 3, 2, 1. All right, 30-second break, guys. So as I said, our next exercise is a lunge. So I'll just do this one on the side. So you can see me holding onto a wall, step back, go down and up. And I only want you to go down as far as you're comfortable with, changing legs left and right, or you could do a squat. So we're going to go in the next 5 seconds here. So 3, 2, 1. Off we go. So holding onto a wall or holding onto a chair if you want to. We're just going to change sides. Left foot, right foot. Nice, Sabina. Very good, Beatrice.
Show off. That's all right.
Last little bit, guys. You got 5 seconds here. 3, 2, 1. All right, 30-second break. So remember, you can grab a drink anytime, but we're just going to keep going through. So you got 30 seconds rest, and we're going to go back into our walking.
Where?
I think I have that cup of tea not on.
How did you go with did you do squats, Colin?
I did the squats. Yeah.
All right. All right, we got 5 seconds. So 4, 3, 2, 1. Straight into our walking on the spot. And then we're going to do that all again. So we're going to do a few rounds of this one. All right, 3, 2, 1. Have a break. All right, grab your drink of water, guys. That was our first round, and then we're going to do that all again. So if you need to, have a bit of a drink. Otherwise, we'll go straight into it. All right, so our first exercise was using the chairs, and we did our squat, and then we did our side kick, left and right. So we're going to get started with that one, all right? So 3, 2, 1, off we go. 30 seconds squat, side kick, side kick. Good, guys. So you're just working at your own pace for 30 seconds here. Last little bit, 3, 2, 1, have a break. So as I said, 30 seconds to rest, and we're gonna go straight into our walking. So clearing your area, if you've got your chair in front of you, you need to move it. All right, 5, 4, 3, 2, 1. Starting that walking.
All right, let's go.
Good. Keep that walking up. So if you're finding it a bit slow, make sure you're picking up your pace. Last 10 seconds, a little bit faster this time. 3, 2, 1. All right, grabbing your dumbbells. So remember, this one is where we make those L shapes with our arms. So you've got a bit to go, so have a bit of a rest if you need it. If you want to get started, you can get started. All right, last little bit, 5 seconds. And 3, 2, 1, up we go. Raising those arms up to your shoulders and back down. Great, guys, a few more. Three, 2, 1. Ooh, have a break, put those dumbbells down. All right, from there, our next one is walking, and then we have a break, and then we go into our lunges. So 5, 4, 3, 2, 1. Walking on the spot. Good, just moving your body, and remember, keep it up. Keep that intensity up. So you're not just doing a slow little walk. Think about doing a quick little step with your feet, up and down, up and down. All right, 5 seconds. 3, 2, 1, have a break. So remember, our next one will be the lunges, stepping back, or the squats in the air, whichever one you prefer. We're going to do that for 30 seconds and then have a break. So if you need a chair or a wall set up, get ready. All right, we're going to go in 3, 2, 1, off we go. Stepping back with your left foot and then with your right foot. So you're always changing sides, you're always alternating. Doing well, guys. Keep it up. A few more. We got 3, 2, 1. Have a break. So remember, keep having a drink of water if you need it. We're going to have a bit of a rest, and then we're going to go straight into our walking. All right. So a few more seconds, guys. Doing really well. All right, 3, 2, 1. Walking on the spot. Good, keep going, guys. Halfway. We're going to chuck in one more exercise. So after this, we're going to have our 30 seconds rest. And then we're going to do a wall push-up. 3, 2, 1. Alrighty. So we've got 30 seconds break. So I'll just add in a quick another one. Finding your wall, arms straight, and we're going to do our wall push-ups. Or you can do this one on the bench. So making sure you've got somewhere to go. So anywhere you want. And we're going to go in 10 seconds. We're going to, again, do this for 30 seconds and then have a break. So 3, 2, 1, off we go. Good, so pushing till your arms are straight. You're going to bend your elbows and go down as far as you can and then push back up. Keep going, guys, a few more. Two more here. 2, and last one, 1. All right. Have a bit of a break, come back to the middle. We're going to finish off with our walking. So just give your arms a bit of a shake. Roll your shoulders back.
Yeah, good, thank you. Good.
All right, this will be our last one. So 3, 2, 1. Walking on the spot. This is it, guys. This is our last exercise, and then we'll do our walk down. So you've done well today. Moved your body a bit and then had a bit of education. So with today's exercise, we've got about 10 seconds left. And then we'll do our cool down and our stretches. Good. 3, 2, 1. All right. Grab a drink, guys, and then we'll come back together. So if you need a drink, grab one. So the exercise that we were doing just then, that's an example of your moderate continuous exercise. So we're working for that 30 minutes. And then we have those sort of regular rest breaks, and that's what we call interval work as well. So you did that 30 seconds on, 30 seconds off. We're going to go do our calf stretch to start off with. So you need a wall, hands on the wall, 1 foot in front, and then lean forward so you feel a stretch on your back leg. So keeping both feet flat on the floor, 1 foot in front of the other, lean forward and hold there.
Keep your foot flat on the floor now.
Good, so just nice deep breathing. You should be feeling this in your back leg. All right, switching sides, standing up. 1 foot in front of the other, feet flat on the floor. Once you've got that, lean forward. And again, you should feel this on your back leg. So keep leaning forward until you feel a stretch. All right, standing up, coming to the middle. We're going to do our arm stretch. So coming back to the camera, watching me. We're going to do one arm across our body, the other arm up, and you're going to do a nice clock arm stretch here. Yeah, that's it. And then just pulling your arms back. Just take a couple of deep breaths here. Just be really aware of your breathing and try and bring it back down to your normal breathing state. So deep breath in through the nose and out through the mouth. All right, other arm. Other arm comes across. Other arm up. In through the nose and out through the mouth. Nice, easy breathing. Try and control it back down now. All right, relaxing back down. Just go into your shoulder rolls here. So rolling your shoulders gently back. Good, we're going to do our hamstring stretch. So you might need a seat for this one. So grabbing your seat, just move my camera down a bit. All right, so that 1 foot straight, 1 foot bent. You have your arms crossed by your side. Big breath in and breathing out, going as far down as you can. If you stop at the shins, that's all right. So grabbing your shins, your ankle, your toes, wherever you can feel sort of the back of your leg holding that stretch. Couple deep breaths here, guys. Nice, easy breathing. All right, relaxing, coming back up. We're going to do the other leg now. So other leg out in front and sliding your hands down. You might find one leg is tighter than the other. And you might find you need to spend a bit more time on one side compared to the other. All right, sitting back up. All right, guys, that is your Tuesday ERA class. I hope you all enjoyed it and found some benefits. If you have any questions, let me know. Otherwise, have a great Tuesday.
Thank you.
Thank you.
Thank you. You have a great day.
Thank you.
Thanks,
See you
guys.
Thursday.
See you
Bye.
Thursday. Bye.
Bye.
Bye.